It's amazing how something as fundamental as conversation could be transforming elderly care as we know it.
Here's something that stopped me in my tracks. Nearly 40% of adults over 65 report feeling lonely on a regular basis, and that number has doubled since the pandemic began. Supporting our older population matters more than ever.
Those numbers are staggering, and they really highlight how isolation affects our aging population. What other challenges are we seeing emerge?
Well, it's fascinating because isolation is just the tip of the iceberg. Studies funded by the National Institute on Aging show that lonely older adults have a 50% higher risk of developing dementia and a 30% increased risk of heart disease. It's like this cascade effect where social disconnection literally impacts physical health.
Hmm. But the iConnect study showed how even simple weekly phone calls can reduce depression symptoms by up to 40% in older adults.
Exactly right. And here's what's really interesting. The impact varies significantly across different cultural backgrounds. For instance, in Asian American communities where multi-generational living is more common, isolation rates are about 20% lower than the national average.
That's such an important point about cultural differences. How do these varying backgrounds affect the way we should approach support?
So get this. Research from the National Institute on Aging shows that cultural competency can increase positive health outcomes by up to 35%. It's not just about speaking the same language. It's about understanding generational experiences. Like, someone who lived through the Great Depression might have entirely different views on financial security than someone who grew up in the 1960s.
You know what's fascinating? The way historical events shape these perspectives.